Hi everyone, thank you for tuning in. My name is Larissa. Today we're going to be talking about a near miss event that happened in a medical surgical unit during my clinical rotation. This reflection is going to focus on patient safety, the events, how it happened, and what I learned from this experience. During one of my clinical rotations on a medical surgical unit, I was caring for a patient with a history of type 2 diabetes who was admitted for pneumonia. The patient was on a sliding scale insulin regimen with blood glucose check before meals. This situation was considered a near miss because it involved a delay in insulin administration and documentation. But the issue was identified, corrected, and the patient did not experience any harm from the situation. Like I said, the patient was an adult who was admitted with pneumonia and shortness of breath. The medical history included hypertension and type 2 diabetes. The patient was receiving IV antibiotics, oxygen therapy, and a diabetic diet. Blood glucose levels were checked before meals, and insulin was given according to the sliding scale order. The near miss involved insulin being given after the patient had already had their breakfast instead of before meal as ordered. I was working with the nurse during the morning medication administration, and the patient's blood glucose was checked before breakfast, and the sliding scale order indicated that the patient needed insulin to be given. However, due to multiple tasks and interruptions on the unit, the insulin was not given immediately, and the patient received their meal, and shortly after the nurse realized the insulin had not been given to that patient yet. The nurse then gave the correct insulin dose, and it was after the patient had already had their breakfast, which was not the intended timing for that medication. The RN then completing a late entry on Epic, which is the EHR that we use, documenting the exact time that insulin was given, the reason for delay administration, and documentation. An incident report was also completely complete per facility policy because it involved a potential medication documentation and timing error. The charge nurse was also notified of the situation since the patient remained stable and there were no signs of hypo or hyperglycemia. There was no need to notify the provider, a rapid response team, or a or call a code. And no new orders were received because the patient remained stable and the correct dose of insulin was given to that patient. We did not have to notify the patient's family. But we did talk to the patient. We informed that the insulin was given a little bit after the time schedule and before, and actually after they had already ate their meal. We assured the patient that we were going to monitor his blood glucose very closely and gave him education on how to notify us and what he should be on the look for. So, like I said, we gave him some education, what was important. One of the educations was signs and symptoms of hyperglycemia and hypoglycemia to call us if he was feeling any dizziness, if he was feeling weak, sweaty, clammy, any of those things that would be abnormal to notify us, and we would come to check on him. We also educated the patient on the importance of the timing that insulin has to be given before meals, and the type of insulin he was receiving in that case. Assessments finding related to the near miss. At the time of the incident, the patient was alert and oriented. Vital signs were stable, no signs of hypo and hyperglycemia, like I said. Blood glucose was within range for requiring insulin, but it was not anything abnormal that would require calling for the provider or anything like that. We checked for labs and diagnostics, and the relevant findings in this case was WBC was slightly elevated because patient had pneumonia, which was something that we expected. We also checked for electrolytes, which was within normal limits. The pre-meal blood glucose was also within limits for the insulin sliding scale. No other abnormal labs um, were directly related to this near miss. After the insulin was administered, the patient's blood glucose was monitored closely, like I mentioned before. There were no signs of hypoglycemia, and the patient tolerated the situation well and remained stable throughout the shift. The follow-up plan of care for this patient included continued blood glucose monitoring before meals and at bedtime, ensuring insulin is given at correct time in relation to meals, reinforcing safe education, timing practice, and continued patient education about diabetes management. Now we're going to do a little bit of reflection on this incident. What did I learn and how will I change my practice from this incidents? From this experience, I learned how important timing is with insulin administration. Even when correct dose is given, giving it at the wrong time can increase risk for hyper or hyperglycemia. This experience reinforced the importance of prioritizing time-sensitive medications such as insulin, avoiding delays caused by interruptions that happen with the situation, and the need for clear communication with patient and the team. In my future practice, I will prioritize insulin and other time-sensitive medications, double-check timing before meals, and communicate with patient about when their medication will be given. Did the EHR or technology help or hinder? The EHR helped because it allowed accurate documentation, like I mentioned before. It created a clear record of when the insulin was actually given and supported transparency and patient safety. However, the delay have been related to multiple tasks and alerts in the system, which can sometimes slow workflow. What should be done differently in this case? Pre the near miss, insulin should have been given immediately after checking the blood glucose, and the nurse could have prioritizing giving the insulin to this patient before going to other patient's room. Post the near miss, delay entry of the incident and incident report were appropriate. Reinforcement of the medication timing protocol should happen, and safety education on time-sensitive medications could help prevent similar events. The healthcare teams involved in this situation were the primary nurse, the nursing student, which was me, and a charge nurse. What each team member could have done differently in this case, the primary nurse could have prioritized insulin administration to this patient. Me as a student nurse could have assisted by reminding or helping prepare time-sensitive medications to the nurse, and the charge nurse could have supported staff with workload and interruptions like happened in this case. So just to finalize, this near miss showed how easily medication timing and errors can occur in a busy medical surgical unit. Even when the correct medication and dosing are given, timing plays a critical role in patient safety. This experience taught me to prioritize insulin and other time-sensitive medications, communicate clearly with patients and my team, and document it accurately and promptly. Overall, this was a valuable learning experience that will help me provide safer and more effective patient care in the future. Thank you so much for watching this video, and I hope you guys learned something too.